So hi, everyone. I'm John Schmidt, Senior Vice President of the ACO Exhibit Hall, and I want to welcome you to this, to this week's Exhibit Hall Flash interview. Our guest this week is Zack Caplan, Director of Provider Network and Strategy for Stellar Health. And I've spent some time with the company, and I got to tell you, this is one of the most innovative, energized companies that uniquely incentivizes provider organizations that are dealing with value-based care goals. So I think you're going to find this really interesting and fascinating. So welcome, Zack.
Thanks, John. Appreciate the introduction. Thanks for having me.
Sure. So I got a few questions for you today that I think, again, your response will be very interesting to our listeners. And let me start out with why would an ACO need Stellar Health services? So in other words, what does the company do for ACOs that can be of help to them?
Yeah, thanks, John. What we really focus on is helping ACOs of all different shapes and sizes, whether you are a health system who's expanding into Medicare or Medicare Advantage ACOs, or you're a standalone ACO. What we really focus on is how do we help those central organizations drive performance for their providers, really focused around what is it that you can do in order to put information in the hands of your providers and staff and create a unique incentive structure that actually empowers them to really change behavior that lead to the results around quality, around coding accuracy, around total cost of care initiatives that really allow you to not only succeed in your existing ACO arrangement, but have the muscle memory and have everybody rowing in the same direction in order to be able to take on that next level of risk.
Yeah. That is much needed, Zack, by many of the ACOs. Let me ask you the second question. Why does Stellar Health, or what does Stellar Health do, I should say, for its clients that is, let's say, different from any competitors that you may have?
Yeah, the big difference of the Stellar Health model is what we allow ACOs to do is prompt at the point of care very granular micro actions, the things that really lead to better outcomes. Things like your patient might have come in for a sick visit, but we want to make sure that their A1C is being appropriately controlled, that they're planning to go pick up their medication next Friday. All of these little things that you want your providers and staff to be talking with your patients about that lead to better outcomes, but haven't historically been incentivized. And so what we do is we actually prompt at that granular of a level for providers and staff, and then we allow the ACO to actually reward those actions in real time, where the providers and the staff can track how many dollars they've earned for completing these actions. We call them Stellar Value Units, SVUs, as a play on RVUs. And on a monthly basis, we actually take on the payment administration so that they can be rewarded each month towards these actions that lead towards shared savings, instead of needing to wait 12, 18 months to get a check, right? Where by the time that happened, it's really difficult for your providers and staff to remember what is it that they did that really led to these better outcomes.
Well, I like that. I think a lot of ACOs are going to be very interested in this as well. So that's impressive and very intriguing. So for more information, any of our viewers ought to take a visit to the Stellar Health booth at the ACO Exhibit Hall. Zack's contact information is right there on that glass screen. And at that point, I just say thanks again, everybody, for joining us today. And thanks, Zack, for providing us a very interesting few minutes of your time. And I just want to wish that everyone will stay safe and well in this crazy pandemic time. So thank you again, and hope you do well.
Thanks, Jeff.